Welcome students to Pathophysiology. This is the first time William Penn has offered this class to undergraduate nursing students, and I'm excited. My name is Joyce Chenard. For those of you who haven't met me, I am an adjunct faculty here at William Penn. My full-time job, I am a nurse practitioner for Great River Health in Burlington, Iowa, and that's my day job, but I do love teaching and I love pathophysiology and pharmacology, so here I am. This class is going to be taught virtually, so all of your lectures will be online. You will also be using the ATI Engage series. We do have a optional textbook, and you'll be taking a quiz every week in ATI, and then you will have 3 in-person proctored tests during the semester. So for William Penn, for their hybrid classes, it is required that we meet 3 times in person. So your 3 proctored tests will be proctored either by myself or another member of the nursing faculty. So let's get into Moodle and talk about our class. So let's get you oriented. So this is Nursing 399, special topic pathophysiology for nursing practice. Announcements, I won't have too many of them, but they will be right there. Our syllabi, let's go ahead and look over the syllabus together. We have it linked right here. Excuse me. All right, so this is me. I am a master's prepared nurse. I'm an advanced practice nurse. I have my cell phone and my email here. Now, students, I do work full-time somewhere else, but you can always reach me by email. My email goes directly to my phone. I get a notification, and I usually get back to students within 24 hours. This is a hybrid class, so all lectures and quizzes are online, but you will meet in person for 3 tests. So 3 tests and then your final. You need to have your ATI account because that is where you're going to be getting your Engage series content. That's where the bulk of your information and your knowledge is going to come from, is the Engage series through ATI. I do want you to have a Boodlebox account. You can either have a free account or one that you pay for. I do prefer the one that you pay for. This is a education platformed AI, and we're going to be using that throughout our class. Furthermore, let's come over here. We do have an optional textbook. I like the textbook. I like, I'm old. I like printed paper. And this is just a good resource, especially to keep with you after you start practicing as a nurse or if you go on to get your master's degree. We'll go down a little bit further. We've got our mission statement. Uh, Course objectives is to learn pathophysiology and to be able to pass NCLEX style questions. Because let's be honest, students, you can get all A's here at William Penn and pass all of your classes, but if you can't pass boards and pass those NCLEX style questions, does it matter? Because then you can't practice as a nurse. All right, so coming back down here, we've got the grading policy. It's the same for all of the nursing classes. We've got our academic calendar. And then here is our course schedule. So this week, week 1, we are doing Engage modules 1 and 2. This is also using chapter 1 in our optional textbook. So the content we are covering is cellular function and adaptation and foundations of pathophysiology. You will have a quiz in ATI with a locked browser that you will do on your own time. As far as when to do that, I plan on right now, I plan on opening up the quizzes Thursday that week, and then you will have from Thursday until Sunday to complete those weekly quizzes. You will have a quiz every week on the content that we are covering. Okay. Coming back over here, we will take attendance 3 times. That will be your 3 in-person proctored tests. You have pathophysiology is difficult content, so I have created my own chatbot catered to you, teaching you pathophysiology. This is through Boodlebox, so you have your own personal tutor 24/7 because this is difficult and challenging content. Furthermore, so we've got our greeting here. Hi, I'm Professor C's pathophysiology tutor. I am here to help you understand pathophysiology and help understand those difficult content. And then we will also give you an NCLEX style question. So let me give you an example. Help me understand the difference. So help me understand the difference between ischemia and infarction. So the Boodle box is gonna think about it. It's gonna break it down for me, and then it will give me an NCLEX style question. So if you need to ask for help, that's great. It can help break down that information for you and then help quiz you over it. So one is reversible, one is irreversible. One is a complete blockage, one is not. So we've got some nice analogies here, clinical example, and then it will come down here and it will give you an NCLEX style question. So let's read that NCLEX style question together. A patient presents to the emergency room with severe chest pain. Which of the following assessments would best indicate to the nurse that the patient is experiencing a myocardial infarction, tissue death, rather than myocardial ischemia? So option A, the patient reports pain radiating to the left jaw and arm. B, the patient's chest pain is completely relieved after 3 doses of sublingual nitroglycerin. C, the patient's laboratory tests are showing significantly elevated levels of serum troponin. And D, patient is experiencing shortness of breath and diaphoresis. So once we complete the cardiac week, you will be able to easily answer this question. And when you put in your answer, it will not only tell you if you're right or wrong, but it will explain why you're right. So, guys, this is a resource that I've created for you guys because pathophysiology can be difficult. And I don't know about you, but when I was a nursing student, my schedule was all over the place. I was working at this time, and I would have class at this time, and then studying might be 2 o'clock in the morning. So if you are a 2 a.m. studying person, you have a tutor available 24/7. Okay, so let's come back over here, get back into Moodle. Okay, so when you get into the class, you are going to start here and look at the video you are currently watching, and then you have 3 lectures that are ready to go. So each week you will have a recorded lecture. I understand having it be an online class, it can be a little bit intimidating because a lot of online classes you are expected to read and study the content all on your own and then go and be tested on it. And I'm not going to do that. Rather, what we're going to do with this class is I'm going to have you log on to Moodle. You're going to watch my lectures first. My lectures are going to break things down into little digestible pieces, kind of get you up to speed and prep you to go through the Engage series on ATI because not everybody has the same foundation. We want to kind of get everybody on the same playing field before you try to tackle that ATI content. And then, of course, you will have your ATI quiz every week. So we will do that, which is a little bit different than what we've previously done with traditional in-person classes. Traditional in-person classes, you're supposed to study and prepare and then get ready for lecture. Whereas here, we're turning that on its head. We're going to have you watch my lectures first and then go through all the content. And another blessing with teaching this virtually is you can rewatch the lectures. If you are a person that fidgets a lot and has to do something, well then put my lecture on and fold your laundry at the same time. This way you can kind of keep your mind going. So and by all means, you can always email me with questions. I will also have some intermittent office hours that I will do virtually. You will not have to attend them. I will not take attendance, but I will let you know that I will be available live on Teams a couple of times throughout the semester. If you just want to drop in and ask a question or clarification, by all means, you'll be able to do that. So hopefully that answers your questions and gets you ready to start the semester here with ATI and pathophysiology here in Moodle, and hopefully you'll be ready to go and you will be better nurses for understanding pathophysiology, and you will be able to take better care of your patients. Okay, thank you.